Hello, my name is Dr Dickson and I am a GP with an interest in tinnitus care from Northern Ireland. Today I will be giving you some practical advice from a GP perspective on when to see your GP, how to select your GP, what to expect when you see your GP, and what happens after your initial assessment. This is not meant to be a one-stop shop for all your medical needs and does not replace individually consulting with your own GP about your own tinnitus. Before we go into this in more detail, I want to just clarify with you what is meant by tinnitus. Tinnitus is the perception of sounds in the ear or head that does not come from an external source and may take the form of ringing, hissing, humming, buzzing, whistling, and even musical sounds. Often when people come to see me, they will tell me they have tinnitus. This may have been from a quick Google search, which I would always encourage. Sometimes people are right, but sometimes it may not be tinnitus, and you may end up leading the GP down the garden path. So it is really important that you explain to the GP exactly what you hear. So if you think you may have tinnitus, when should you see your GP? My thoughts as a GP, which applies to most symptoms, is if tinnitus is bothering you, no matter how big or small, I want you to talk to me about it, especially if it's affecting your life or sleep. If the symptoms are constant or getting worse, you need to talk to me. There are also situations where we want to know about your tinnitus more immediately, such as if it occurs after a head injury, if there is sudden onset of hearing loss, weakness in the face or spinning sensation, or if the tinnitus is causing you distress or suicidal thoughts. We want to hear from you. So how can you access your GP and who should you talk to? You can access a GP in urgent care or via your own GP practice or privately via telephone, video consultation, online or in person. All GPs will have a basic knowledge of tinnitus, however, some GPs will have a special interest in this area. When choosing a GP, look for those with a special interest in ear, nose and throat, or a GP you feel you can talk to and feel heard. You can find out from the receptionist or looking online at their credentials, such as those with MRCS, ENT, or DOHNS after the name are strong indicators they may have more knowledge in this area. You may wonder why you need to see a GP. It is important if you have tinnitus that you seek advice from your GP so that they can try to understand what may have caused your symptoms and make a decision together with you regarding ongoing management and referral if this is necessary. Often people with tinnitus can have an underlying hearing loss which needs treated, which could make huge improvements in your quality of life. So what will happen when you consult your GP? Unfortunately, care of people with tinnitus by GPs is not standardised, and there may be variations throughout the UK. In addition to this, COVID-19 has brought many challenges as to how GPs consult, and your consultations may initially be delivered via telephone or video in the first instance. The new NICE tinnitus guidelines on tinnitus assessment and management have a real focus on how tinnitus is affecting a person. The link can be found in the notes section and at the end of the presentation. As these are new guidelines, the GP may not be aware of these changes. Some questions they may ask you are how tinnitus affects you, such as the impact on your sleep, quality of life and your mood. They may consider using questionnaires for this as well. These questions are all to form a picture of you and your tinnitus experience so that we can help you. Your GP may also carry out a further assessment to include history, examination and investigation, and this is in line with guidance from the NICE clinical knowledge summaries on tinnitus. You may be asked when your symptoms first started, if the tinnitus comes and goes, or if it is continuous. You may be asked to describe your tinnitus and if it is in one or both ears, or if there are any other associated symptoms such as weakness or the room spinning. Your GP may want to know what may trigger the sound, such as stress, any medications you may be taking, and any past medical problems. Depending on your symptoms, you may be asked to attend for examination. This may include examination of the ears, nose and throat, and blood pressure check. Your doctor may listen to the heart and other structures and perform a general examination. From this, they may decide to check some bloods or perform a hearing test if this is available in your practice. Now that the GP has assessed you, you may expect to be provided with support and information for your tinnitus. This is something new that has come out in the new NICE tinnitus guidelines, so for a lot of GPs, they may not even be aware of these changes. Again, this level of support and information may vary, but by having an idea of what may be helpful, I would encourage you to ask questions from your GP, and if your concerns are not addressed, talk to another GP. In supporting you, your GP may discuss with you the impact and any concerns you may have about your tinnitus. One big concern some people with tinnitus have is that something serious is going on. This is rarely the case, but you should talk to your doctor if this is your concern. During this initial assessment, if you have any specific needs, a management plan will be agreed with you. Your GP may discuss results of your assessment and impact on your management plan. Having symptoms of tinnitus can be frightening for some people, and that is why being given accurate information is important. Your GP will provide you with information in relation to tinnitus, such as tinnitus is a common condition, it may resolve itself, it is commonly associated with hearing loss and not commonly associated with other underlying physical problems. There are no medications that will take your tinnitus away. However, you may be offered strategies to help you manage your tinnitus, such as self-help and coping strategies, for example, self-help books, and also trying relaxation strategies. Other information your GP may cover or that you should ask about is what tinnitus is, what may have caused your tinnitus, what may happen in the future for you, what may make the tinnitus worse for you, such as stress, ways you can practice safe listening, such as using noise protection, and the impact of your tinnitus on your life, such as the effect on sleep. Understanding that it may affect these aspects of your life will enable you to talk about the effect this may have on you, and I would encourage you to talk about this so your GP is aware and that we can help you. Depending on your assessment and potential underlying cause, your GP will manage this with you as appropriate. You may be given self-management strategies or referred to local and national support groups such as British Tinnitus Association for further help. In some instances, based on your assessment, you may need onward referral to specialist services, which may include ear, nose and throat, audiovestibular, audiology services, or mental health services, where they will assess you again and decide with you on a management strategy. It may be helpful to ask your GP regarding the urgency of your referral and to give you an idea of what the waiting times currently are. There are times where you don't feel like your GP consultation went so well, and you may not have felt understood or heard. If you feel like this, talk to another GP, talk to someone from the British Tinnitus Association, and do look after yourself. And if that means asking for a referral to a specialist clinic for further assessment, ask your GP for this. Thank you very much for taking the time to listen to this presentation today, and I really hope it has been of some help to you. The information contained in this presentation represent my views as a GP, as well as some resources from the new NICE guidelines on tinnitus assessment and management, as well as some resources from NICE clinical knowledge summaries on tinnitus, the references of which are on the following slide. If you have any further questions you would like me to answer, I would be happy to answer these or direct you to a place where you can get those answers. Thank you very much.
Thank you for that, Emma. That was really useful, and I hope others kind of found it useful for. I think it's a good overview of how the GP appointment would go. So I just wanted to maybe touch on one of the key elements there before we move on to the question, which is the new NICE guidelines, which some might not be aware of, which were published in March this year. Could you just kind of give us an overview of what they are?
So the key message really from the new NICE guidelines from a GP perspective, and because I'm not going to go into the secondary care aspect of the NICE guidelines, was the utilisation of good information and support from GPs and all healthcare professionals at each point of contact that a person who had tinnitus would have with a healthcare professional. Prior to the new NICE guidelines, it was felt that the provision of information and support for people with tinnitus wasn't the best. And so really the aim of the guidelines is really to drive home that message, that because that's what people who had tinnitus wanted. They wanted to have more information, they wanted more support, and they didn't know where they could get that. So hopefully these new guidelines, once they roll out to GPs, because obviously with this coronavirus hitting things and the release of the guidelines happened in March, it wasn't great timing for the tinnitus guidelines because GPs were bombarded with everything else that was going on. So really the key message from that first consultation with your GP should be getting the right information and getting the right support from day one.
That's great, thank you. And obviously in the presentation you mentioned about if your consultation didn't go very well, speak to another GP. How would you go about that? Because I can imagine some people might be a little bit nervous, especially if it's a very kind of small town and everyone, do you know what I mean? It's it feels like you're going behind someone's back in a way. So how would you approach that situation if someone doesn't think that they got the information they needed or the support that they needed?
I actually feel that people are really good at choosing who to go to in terms of their healthcare professional, particularly their GP, when they have certain needs. So I know for myself, I will attract a certain type of problem. So I will have people who, if they have an ear, nose and throat related condition, they will come to me. Or if they've maybe a mental health issue, they will come to me. But my colleague will always have people going to her if they maybe have a women's health problem, because that's their area of expertise. And people tend to do that anyway. And your GP will not be concerned if you go to a different colleague. They actually would encourage that, because we all, like us as GPs, we do not know everything and we accept our limitations. And so some people may have more knowledge in some areas compared to others. And we would often, well, certainly I would often ask my patients if they came to see me and I didn't feel as knowledgeable in that area, I would ask them to book back to see one of my colleagues. And in actual fact, we like that. We like that, especially if you have a big team of doctors in a practice, you share your knowledge base and you would often ask each other lots of questions. So I wouldn't feel afraid of asking a different doctor if you didn't feel comfortable with that doctor. And there's lots of factors that will come into play as well. Like your personality may not click with a doctor's personality, and that's okay. And because we're all human, we all have friends that we like, some we don't like. So you have to treat your healthcare professional as you want to go to someone that you would feel comfortable with and that is open to talking to you. And maybe that person you feel comfortable with, but maybe they don't have a good knowledge base, but they will likely then go and find the right information for you. So never be afraid.
Yeah, and I think that's a really important message to take away. Don't be scared. Essentially, if you're going to that point where you're going to see a GP about your tinnitus, you've obviously got some level of worry. So you want to get the best care and support that you possibly can. So someone with maybe more knowledge of ENT or just tinnitus in general, I think would obviously be useful to the patient. And another question that's come in, so what if there is no ENT specialist in your own GP? How else do you get help stress in to the local ENT hospital that your issue has an impact on your life? And I suppose that obviously comes from a lot of COVID and waiting lists and waiting times. I suppose that all plays a factor in that, doesn't it?
It is a massive challenge at the minute, and there will be a lot of GPs that have just a basic general knowledge of tinnitus, and that's where we would rely a lot on our secondary care specialists and our audiology specialists and audiovestibular services. Each region will have very different services available. So, like for example, in London, they will have an audiovestibular service which will be very well set up for tinnitus, people who have tinnitus. In Northern Ireland, which is where I'm from, we do not have an audiovestibular service, but we have ear, nose and throat specialists and there is a specific tinnitus pathway that we can refer people into, and there will be audiologists who are trained specifically to manage people who have tinnitus. So if your GP hasn't got that knowledge base and it is affecting you, it is in the referral guidelines that if this tinnitus is affecting you and it's still there, then you need to be referred and you need to be assessed by a specialist. And some of those services are still running, albeit in a very different way. And I think that's a key point, that we haven't stopped working. We are still working. Hospital specialists are still working. Audiologists are still working. It's just they have to see you in a very different capacity. So we don't want to be bringing everybody in to hospital all at once, because that's going to be a big problem.
Yeah, no, definitely. And I think the thing is as well, it's kind of a vicious cycle in a way, especially if you're on a waiting list to see an ENT and you're being told, and you're waiting and you're waiting, and then it's putting more stress, making your tinnitus worse. So it just has an impact, doesn't it? Overall. Do you have any kind of, I'm putting you on the spot here a little bit, but do you have any advice to those that are on a waiting list and are currently, their stress levels have increased due to everything going on in the world, plus not being seen yet? Is there anything that people can do or help the situation?
So for up-to-date knowledge, information, I would be suggesting to go on to the British Tinnitus Association for certain. They have a wealth of resources. One of those is an app called Tinnybot, which Maisie might talk about later on with you. But what that app does is actually incorporates cognitive behavioral therapy techniques and mindfulness techniques, which from the NICE guidelines has been recommended as being helpful for tinnitus. And so it's something that you can have on your phone and readily use on a day-to-day basis. Often tinnitus, there is a lot of underlying anxiety or depression, and things like a Headspace app can be really helpful for people in terms of relaxation techniques. And so it's trying to understand really what has triggered these symptoms, or what the underlying problem is, because it could be underlying anxiety or mood-related issues, but it could be other underlying medical conditions such as anemia. So you need to open that dialogue with your GP first. I find that a lot of people don't open that dialogue with us, or through that they have tinnitus into a consultation as they're leaving, after they've maybe been on the phone to you for a while, and then say, oh, I've still got that tinnitus. Or whenever we were seeing everybody in the 10-minute slots every day, they would be walking out the door and telling us about it. So you need to come and talk to us more about it, because I think sometimes people don't want to talk about it so much, and then they maybe meet a bit of resistance from the GP, who maybe doesn't have a lot of knowledge in it. So open up that dialogue as best as you can. And if that doctor doesn't know much about it, do talk to someone else. It's really important.
Yeah, and I think the one important thing as well, especially if it's affecting your life and your sleep, with everything going on, I think it's easy for people to just assume that, oh, it's not as important as what else is going on in the world. But at the end of the day, it's your health, and it has a knock-on effect, especially lack of sleep and things like that. I think it plays a massive part to a possible spike in your tinnitus. So, like you say, it is important to just speak to your GP. Someone has said that they've spoke to two GPs at their surgery, and one did advise to get in contact with the BTA, which is great. But the other one referred them to a ENT, which took 6 months to get an appointment, and even then, on the day, they were seen by a nurse and not a specialist. They took the plunge and paid to see a private ENT, which they've said was a waste of money and time. One look in my ears and concluded that they had mild tinnitus and it would go away. They don't consider it as mild, and it certainly hasn't gone away, and they don't know where to turn now, which obviously going private is a big step. And I suppose we've had more of these kind of questions come in recently, especially with waiting lists and things being quite long and waiting times. What would you advise to someone like that who's gone through the process in a way and still not received the support or the information that they need?
I'm really sorry that you experienced that, and that's why obviously the guidelines were made, because people have been experiencing that kind of service. And from when I refer someone into a specialist, I'm hoping that they can help me in terms of management of that condition, because maybe I have done everything that I can and I'm not sure where else to go. I can't really pass comment on that specific ENT consultant. I can't, because like GPs, they have their different subspecialty areas as well. And I don't know if there is an audiovestibular service within your area that you could maybe ask to get referred to, because audiovestibular physicians will be dealing in the medical aspect of ear-related conditions such as tinnitus and vertigo. You may have that service in your area that you can ask your GP to refer to. I'm not sure, but you may get a different reception if you are referred to them. But I'm really sorry. That's a real shame.
Yeah, it's so sad to hear when you feel like you're getting somewhere, and then especially if you've paid to go private and expect at least some answer. And I appreciate there's no cure for tinnitus as of yet, but to maybe have a little bit more support and kind of a discussion around a management plan. But like you say, you can't comment necessarily on that particular instance. Would you maybe suggest, do you think it's a good suggestion, or how would you feel personally if you saw a patient and you weren't aware of the NICE guidelines and they actually brought it up in conversation and said, well, actually, no, I'm entitled to some form of support here, and I want to discuss further? Would that be okay? Is that quite...
I would love that. I love it. People increasingly come in knowing the guidelines sometimes better than what I do, and often we have to ask people to come back and see us, because we need to go away and educate ourselves, because we're, as GPs, we know a little about a lot of things, and there's so many new guidelines continuously being produced. So a good GP will want to continue learning, and they will be open to receive the information that you have, so that they can then go and follow that up and see how they can provide a better service. And I know that at the minute it's really challenging, because GP services are changing every single day, and it's a really tricky time with people who are bothered with tinnitus at this moment in time, because the priority and the funding has all been taken to managing COVID-19, and GPs are really trying their best. They're trying their best to provide a good service, but it's challenging. It's really challenging at this moment in time. But you need to prioritize your needs and your health. And so if you don't feel that, if you feel that it's affecting you, you need to open that dialogue, and you maybe need to make those suggestions that recommend that you need to be referred onward to the specialist centre. And the problem will be that the waiting times will likely be very long at the minute, and that because of the situation we're in, and that unfortunately can't change right at this moment in time, and it's going to be going on for a few months yet.
Yeah, no, definitely. Thanks for that, Emma. Another question here, or basically someone said that they've seen a specialist surgeon who was not very understanding and kept reiterating that it was all in their person's head. They understand the link between mental health, but they were diagnosed recently, and it made them feel very isolated and had a negative impact on their life. But during COVID lockdown, it feels like it's gotten worse. And I mean, we've since lockdown, since March, I mean, many people that didn't know they had tinnitus, or they've had it years ago, and recently, I think maybe not being in a work environment and working from home, possibly being in a quieter environment, and added stress, I would assume, with that. Would you agree with that, Emma?
Absolutely. We still don't understand the impact that coronavirus has on ourselves. We don't know if it does indeed make tinnitus worse, or is it the stress linked in with everything, because people are under a lot of pressure at the minute, whether that's concerns about their own health or whether that's financial concerns. Each person has a lot of concerns at the minute. And so in terms of stress management, I would be, and I'm certainly not saying that this person who has tinnitus, that's exactly what's going on, but there are ways that you can help manage your own personal stress levels through mindfulness. Things like yoga, meditation can be helpful in terms of reducing your stress levels. And then NICE guidelines do recommend cognitive behavioral therapy for management of stress as well. And so if you don't understand what cognitive behavioral therapy is, it's about understanding the thoughts that you have and how then you respond to those thoughts and how you act. And I'm a believer that everybody needs counselling and everybody needs some form of cognitive behavioral therapy, and to understand themselves and understand their emotions, because it's not something that anybody's really taught. And so if you believe that stress is impacting on your tinnitus, I would suggest, looking at Headspace or looking at the Tinnybot app. You can do online cognitive behavioral therapy if it's like generally for your anxiety and management on lots of different platforms online. There's ones that you'll maybe have to pay for. There's free resources, but if you just Google it, it'll bring you up lots of resources. I don't want to specifically recommend ones because there's so many of them, and each person has a very different style in how they interact and learn, and it's whatever one looks best for you. But a lot of GPs will be able to refer you for counselling or cognitive behavioral therapy, and they may have programs set up within the practice where you can be given a key code and access cognitive behavioral therapy online. And actually with all this COVID-19, there have been a lot of free resources that have been put online for a lot of people to help manage stress, which would normally you have to pay for. So I actually think that's a big push in the right direction.
So we've got a question from John. So are there any questions that they should be bringing up or asking the ENT or audiologist when they have the appointment? So are there any kind of key questions that they should be asking?
The key question I would be suggesting people to ask is whether they have whatever the condition is they believe that they may potentially have. Because one of the big concerns a lot of people come in with is that they believe that they potentially have a brain tumor. And that's why they're so worried and anxious. And so you need to ask them directly if that is your concern, because in most cases it's not. The most common cause of tinnitus is underlying hearing loss. So ask that question if that is your biggest worry and your biggest concern, because if you walk out that door and that question has not been answered, then you're going to continue to worry and your tinnitus is going to get worse. And often people, because I've been on both sides, because I did ear, nose and throat training prior to being a GP, and I've been on the side where someone has come into me when I worked in ENT, but they never asked those kind of questions, and then they continue to be concerned. And I suppose through me training as a GP, where it's drilled into us to try and understand what someone's worries are, that I've become better at trying to draw that worry out and trying to answer that specific question. So I would be advising you to go in and try and get the question answered that you need answered, that is going to give you some peace when you go home. So if that's asking them directly, do I have a brain tumor? Ask that. And because that's why they do a hearing test, that's why they may end up doing a scan if that's necessary. So from those, they should be able to tell you or reassure you from that point of view. And then the next step after that will often be other management, such as psychological therapies, such as cognitive behavioral therapy, or acceptance and commitment therapy. So ask those questions. But that will be individual to you, that question, whatever you're worried about.
I think that's such an important message to take away, because especially for someone that's maybe recently experiencing tinnitus, they're worried that it's a hearing issue and they're going to lose their hearing, and you're sat there and you're thinking about all these worst case scenarios, and then you go to the GP and expect them to have all the answers, I suppose, but just being quite blunt and to the point with them and just saying, look, these are my worries. Can you just either reassure me, give me tests, give me scans? I just need to know for me, really. So.
Yeah. And it is important to note, Maisie, that one of the big things that came out from the NICE guidelines was that there needs to be further research into the type of questions that GPs need to be asking people who come in with tinnitus, because we don't currently know what's happening at that first point of contact when someone sees their GP. So they're hoping to do a bit of research into that area and try to change that so that the GPs become more aware so that they can manage this better. And that, you know, obviously with all the research that's out there, things change so fast. So we need to get that hopefully new research in place to then give GPs a good framework to work off, so that and people who have tinnitus can then feel that they have been listened to, they've been given the right information, they've been supported in the way that they want to be supported. Because not everybody is the same. Some people don't want you to give them much information. Some people just want to leave things there, and some people want lots of information. And so it's always trying to gauge how much information someone wants and how much support they also want as well. Because I know personally, I like to look at things online. I would prefer to just go online and do my own research and then ask more questions. But everyone's very different. Some people are more verbal and they like to talk it over with someone. So it's tailoring that information and the support to the individual.
No, definitely. I completely agree. We've had a comment here saying that their GP was quite honest in a way. And he said he'll be truthful. I don't know much about tinnitus, and it might fizzle out, it might not, but he did refer them to an ENT. And they're actually quite glad that he didn't just say it won't get better, as they can be so depressing when you're so worried in the first place. My ENT was over the phone and last week, but I have an MRI in a few weeks. I feel like GPs could have more info with tinnitus, like charities like the BTA or CBT, and I think that's an important thing to note as well. The BTA are currently looking to explore some form of digital training around the new guidelines for GPs, because as you say, I think there's so many new guidelines and legislation and everything that comes out for GPs to read through and keep up to date with. So the BTA are exploring ways of just spreading the word really on the new guidelines. Matt said, my GP sent me to a CBT specialist who didn't know what tinnitus was.
This is something that was discussed when we were doing the guidelines, that it's obviously a big change that needs to happen in terms of delivering tinnitus specific cognitive behavioral therapy, because not all cognitive behavioral therapists will be trained in managing tinnitus specifically. The CBT therapists most of them are generally good at managing anxiety and depression, but there is a training need there, and that's something that has been highlighted from the guidelines, that will need to change and the service will need to be produced, because it has been shown that tinnitus focused cognitive behavioral therapy is effective, and so it's just getting people trained up in that area, and that takes time. And again, with all this COVID-19 and that just everything just changed in the blink of an eye, but it doesn't mean that that's going to be like that in the future, because people are working away, there are changes being made. It's just hard to see them just at this moment in time because everything's so locked down at the minute, and especially if you're going down into lockdown in England, so that's going to be even more challenging.
Just to kind of clarify, I think the takeaway message from today is speak to GP and be honest with them about how you're feeling and kind of your fears in a way of what tinnitus can mean for them.
Absolutely, Maisie. Like you've hit the nail on the head. The 3 take-home messages will be to open the dialogue with your GP, get information from your doctor, and if you're not getting the right information from them, go to another doctor or go online to the British Tinnitus Association website, which is fantastic. And then if you need support, ask for it if you're not getting it. And if you're not getting the right support in that area, ask to get referred to a specialist. And they will then open up referral pathways to other places, because often GPs can be limited sometimes in terms of lines that they can go down. So please talk to your GP or talk to someone from British Tinnitus Association, or even Action on Hearing Loss as well as another place that you can go for information, but open that dialogue and talk to other people.
Thank you so much, and thank you for delivering today's session, Emma. It's been really, really useful. Thank you very much, Dr. Emma Dickson, and we'll speak to you very soon, I hope.
Thank you very much.
Thank you.